So this is Barbara from the Department of Medicaid Services, and I just wanted to let you know it is 1:59 and I am still clearing the waiting room.
Okay, thank you. I am trying to reboot my computer, but I am connected on my phone. So,
Awesome. So Donna, right now we have yourself, Courtney, and Sherry here. I, there's a few on here I don't recognize. Oh, I see Alicia.
okay. So we have to have four for a quorum, correct?
Correct.
Okay, perfect. I'm going to turn my sound off and see if I can get my computer to work quickly while you're clearing. If you'll let me know when you have the waiting room cleared, I will go ahead and get started.
So Donna, I think it's 2:01. I think we're ready to roll.
Okay, thank you. I don't have my camera on, but I can try. I'm having some technical difficulties on my end with the Zoom on my computer, so I apologize. I have connected by phone, but I will go ahead and try to get the meeting started. And in the meantime, I will, let's say, I don't know. I'm just going to tell you, I don't know what y'all going to see when I turn this camera on. I can't see what I look like, so I apologize for whatever it is. But
You look great.
okay. Well, I don't know what happened. I had a problem earlier with the Zoom and I thought maybe it was just a glitch, but apparently I'm going to try again to connect on my computer so I can see things a little more clearly. But welcome to everyone. Happy New Year to everyone. I believe that we have a quorum. I believe we have four TAC members. Is that correct, or have we had any more join?
So far, I just see four. Miss
Oh,
Erin, do you see any others?
No, ma'am, I just see the four currently.
Hmm.
okay. Well, we have the four members, so we have established a quorum. So if I could have someone, we'll move to approve the minutes from the October 1st meeting.
I move to approve the minutes from October 1st meeting.
Second that.
Okay, all in favor? Aye.
Aye.
Okay. And then thank you all. The next item on the agenda, our meeting date confirmation. Barbara, would you like to share that with us?
I, I just couldn't find my unmute button. Okay, you currently have today's January 7th, of course, Wednesday, April the 1st, Wednesday, July the 1st, and then Wednesday, October the 7th of all 2026.
Great, thank you. Do any of the members have any known conflicts with any of these dates? I know sometimes we run into spring break dates, but I'm not even
Not right
sure.
now. No.
Okay,
No.
perfect.
I don't
Okay.
have any specific conflicts with like the dates can stay the same. But this is Alicia with KYA. I'm gonna be on maternity leave starting in April through July, so I may or may not be there April 1st, and then I probably won't be there in July.
That's amazing. Congratulations.
Thank you.
Congratulations.
That's the great
Congratulations.
news of the day, I think. That's
Mhm.
awesome. Wonderful. Well, we will certainly understand that. And I don't know if you have an alternate for your position or not. Some organizations do and some don't.
I
Um,
will, we are working through my plan right now, so I can
okay,
let you all know if there's another name that we should add for those dates, but I don't know who
okay,
it would be yet, so I'll just let you know.
okay. Thank you. I
Hi,
appreciate that.
Donna. This is
Yes.
Erin. So, just to throw this out there, someone can definitely set in to take notes for Alicia, but they would not be considered a voting member unless
Okay.
they are appointed. Just letting you know, throwing that
Gotcha.
out there.
Gotcha. Okay. And I know at one time, just because I was the alternate for the American Academy of Pediatrics Kentucky chapter, and I think we were both appointed so that when Julia couldn't be there, I could be the voting in her. So if KYA says this is our alternate delegate and appoint her, would that be sufficient, or it has to be more formal than that?
I'm going to be honest, Donna, I'm going to have to take that one back
Okay.
because I'm not 100% positive on that. So, Barb and I will take that
Okay.
back and we'll get you an answer for
Perfect.
sure.
Okay. Well, and we have a little time. So thank you, Alicia, for letting us know, and congratulations again. Okay. Anything else before we move to old business? Okay. I think we had a follow-up on data. I'm so sorry. I'm trying to read this from my phone and I'm way old for this. Follow up on data from eligibility coverage gaps. I think we had asked for the geographic distribution. Um, Kind of what do we know about what areas were most adversely affected by this change? Does someone have that report for us?
Am I? Oh, I'm sorry. I'm growing to myself. Hello. I can speak very top level. I'll be honest. I'm not 100% the granular that you may be looking for. But my microphone on? Yeah, it is. Uh, but our uh terminations for children remain very similar to what they have been in previous months, with the largest number of terminations being caused by that failure to return a form or verification timely, which goes to the undelivered mail problem. We are looking at ways to combat that and improve that process going forward, as well as, I think, even more importantly, notification improvement, so that we can get the right information out so people know what they have to turn in. Many times it's not simply that they're just not turning in anything at all, but that they're getting caught in that loop and not turning in what they need to be. As far as geography goes, it it really is where we would think it would be, where Jefferson County has the largest number of problems with terminations and coverage gap, therefore, and the other regions are all about the same, with the Far East being the fewest. So I can take back specific questions and then get back with you. I'm sorry to have a follow-up to a follow-up, but I'm just being honest. I wasn't 100% sure what you might be looking for today.
Thank you. And I am now on the computer.
Hi,
So
I can
hopefully
see now.
everyone can hear me. Yeah. Did someone else have something to add? I'm sorry. So I think what we had discussed the last time was
Mhm.
trying to see if there were areas. I mean, obviously Jefferson County is probably the one area, but we didn't know, is there an area that's disproportionately affected by the change? And so I think you gave us some information about that, but I would love to know, like, are there pockets in other parts of the state where we're seeing this being a
There,
real issue?
yeah, there may be there are other DMS people on the line, so if they know something I do not at this point, that would be great. If not, however, we can try to dig a little bit deeper, and we don't see anything at the surface level that's jumping out as a problem out of the Far East. We're seeing the same issues that we would expect to see, um, and I don't, how the Far East and the Far West, where the old coal fields used to be, tend to be those pockets that have the same types of problems, but nothing that's saliently jumping out right now. But we can sure take that back and try to find a more specific information as well. The good news is with the legislature being in session is that we have a lot more data that's being percolated to the surface for us to look at. So again, being transparent, I know I'm not speaking very specifically, but we can take this back and get more specifics to you, ma'am.
Okay, thank you. I appreciate that. But I'm glad there's not something that's glaringly obvious, like, oh my gosh, this area of the state's really being hit hard by this. So
Right.
that's reassuring.
And again, in other meetings with the advocates, where we have committed to at least begin the process of the notification improvement project that we did a few years ago, where we literally have advocates, even beneficiaries, looking at the notices and telling us what makes sense, what could be simplified, what could make it easier, so we can redouble our efforts so people aren't, if they do read their mail, if they get it, they're not then sending us the wrong thing or not knowing what the next steps are. In addition to the steps of really trying to make sure people read their mail, change their address, tell us, inform us, because that is the biggest application killer, unfortunately, is when we can't get a hold of people.
Thank you. Any other questions? Okay, moving down the agenda because I was reading from my phone. We've already done the next item on the agenda. So we did confirm the meeting dates. So I think the next part of our agenda will be the presentations from the MCOs.
So, Donna, I apologize. I don't know if everything just glitched, but it looks like Barbara has fallen off. So give me just a moment to get the agenda pulled
Okay.
up. I do apologize. I got booted out as well. Um, so I'm not sure. I'm just gonna say Zoom is just not being friendly today.
It is not being a
Oh,
nice app
oh,
today,
there's
is
Barbara.
it?
So she must be
Okay,
back. And so
I am
with
back.
thank you. You scared me. You left me. Um, so with the presentations, it is under new business, Donna. So what we need the TAC to do is we need the TAC to request from the MCOs today exactly what you want, how you want to see that information presented. And do you want all of them to present in the April meeting? Do you want to break it up some? So if you guys can make that formal request to the MCOs, our last meeting, we just talked about discussing a possible presentation. So we wanted to make sure that the TAC had the opportunity to provide the MCOs with exactly what you would like to see in that presentation.
Yes, and I apologize. I feel like I may have misunderstood kind of what we specifically needed to do to make this happen for this meeting. So, what we would like to know is what kind of information, and again, other members of the TAC correct me if I'm not saying this correctly. We want to know what kind of information they have on e-cigarette, tobacco, and vape use in our adolescent population, and what secondhand smoke and resources for cessation there are for parents and for adolescents through each MCO. Am I stating that correctly, other TAC members?
That's what I have in my notes. Yes, that's what I wrote down.
And I'm going to ask a silly question because I know when we send this over to the MCOs, they are going to have questions about your age range for adolescents. I think that is different in different areas. So if you have a specific age range or a specific, cut off age, I know some, 19, some is 18, some people say 21. So if you have a more specific
Gotcha.
age range, I think that would help our partners.
I feel like in the data we've seen in the past, and again, the MCOs can correct me if I'm wrong. I feel like you all have things broken down in that 12 to 18 age range, and then 19 and above. If I am incorrect, please let me know that. But I feel like most of us are comfortable looking at the data from, about 12 to 18, realizing that there are probably 10 and 11-year-olds that are
Yeah.
unfortunately using vapes as well.
Donna, so we have a tobacco cessation at Passport, we call it a nicotine cessation PIP, on the table, and that has defined for us adolescents as 12 to 17. But if you would like us to look beyond the scope of the PIP, which does not require us to break things down by vape versus cigarettes, et cetera, and you want that level of detail, I think we can accommodate a different data pull beyond the PIP and maybe not use the PIP necessarily as the focus of our presentation to you, because that's a very limited data set. I think the other MCOs might agree with me. We don't have a lot of claims for our teens that allow us to use that for the PIP. So if you want to expand that, we're okay with that. I think in this case, if you're just kind of curious, how many of our members maybe have a claim that indicates nicotine use of some sort in maybe 2025, we could pull that for our full EPSDT population if you would like.
Okay. Yeah. And do you all have, I guess this is another question. Do you all have claims that would be for parents who've asked for smoking cessation assistance, but it wouldn't necessarily be linked to the child, correct?
So I see what you're saying. So this is where you're curious if we would have the ability to parse out when one of our EPSD team members' caregivers is seeking assistance for themselves to reduce secondhand smoke or tertiary exposure. Is that right?
Yes.
That's a little more challenging because we have to map our adult members onto their head of household to see if they have a kiddo, right? So that would be a fairly complex ad hoc data pull, to be honest. What we could do, if you're curious, we could at least look for coding for secondhand smoke for our EPSD2 population. I've pulled that in the past.
Yeah, that would be helpful if that's I realize that would be quite the nightmare to try to link your adult patients with children. So if there are claims that indicate passive smoke exposure, that might be the easiest way for you guys to be able to give us that information. I suspect that probably underestimates, because I suspect that as a provider, we're not always good at as putting that as a diagnosis on a claim.
So Donna, what I can tell you from past experience with this type of data is that if you expand it to the entire EPSTT population, we will find claims for neonatal exposure. So that will show up, and we see that a lot in our littles, and for secondhand smoke. But you are absolutely correct. I mean, I can tell you from Passport's perspective with this PIP, we are generally looking at an average of around 300 to 400 teens showing as having nicotine use. We know that's an underrepresentation. When we have asked our pediatric providers, and I've asked several myself, they just smile and they say, oh, they all lie to me. I'm sure they're using it, but they all lie to me, right? You know that, you're a pediatrician. So it will be a significant underrepresentation and probably not map onto what we see from the state's population health kind of efforts to say this is how many adolescents are using nicotine products. But I think we could pull all of those things fairly easily. Those are simple codes to pull. Again, looking at neonatal exposure, secondhand smoke exposure, and nicotine use disorders that have been coded. We can possibly break those down by vape. We don't necessarily see those vaping claims come through as clearly as simple like nicotine use NOSs. But we could break all those down for the entire EPSUT population if you are curious.
Yeah, I think that would be very helpful. At least it would give us a point of reference, even though we know it may be an underestimation. It would certainly give us a point of reference.
Well, and to your point, since you guys are, activists and trying to work with your respective organizations, I think seeing that data for yourselves and being able to go back to your teams and your orgs and say, hey guys, we might be undercoding and the MCOs are trying to outreach folks and trying to do this work, but they don't know somebody's smoking unless they get it on a claim. So we do have HRAs that ask about adolescent nicotine use. But again, there's a woeful underrepresentation of reporting there because parents are often filling them out and they don't know.
Right.
So, but claims is a great way for us to feel more confident if we're going to do outreach and try to do intervention. So when you see where we probably have some gaps that might help your, all of our great partners on the TAC, go back to your orgs and say, guys, we've got to start coding this more. The MCOs are trying to do some work with us.
No, I appreciate that. That's very helpful.
And this is Dr. Terrio. I have to thank you, Jessica. It's so important. It's kind of one of my pet peeves that nobody uses Z codes. And that's the only way that we can get at some of these things. And we have to do something about it, but how can we if we don't know who's doing what and how much and all of that? And I think physicians really need to be educated on why those codes are important. It's not just, an extra little thing to click. It's maybe something we really have to get into our residency programs and even our medical schools to have people start doing that early on, if we want to make a difference in some of these things. But thank you. You did a great job, Jessica. Thanks.
Thank you, Dr. Terrio. I will add, Courtney, I don't know. I'm sorry, I can't see if you're on right now, but as a pediatric psychologist, I will say the same for our discipline. Yes. Right? We always ask, we spend an hour with a kid at a time, sometimes less, sometimes more. And those are questions we always ask. We don't always put them in our claims coding. And we've done specific
For sure. We don't.
provider education there too, to our BH providers this year to say, just use these codes. And if you happen to do some counseling in your sessions, add this Z code. That lets us know you guys are actively trying to treat this with this child. So yeah, I completely agree. And Courtney, thanks for backing me on.
Sure. Absolutely. Also, in addition to just numbers, we're asking for what everyone's doing as far as prevention too. That was part of your ask too, Dr. Grisby. Okay, just making sure.
Jessica, this is Erin. Just to make sure I got that, EPSDT population, neonatal, secondhand, and nicotine use, were those the categories you said would be best to pull data?
Yeah, I think those would be the diagnostic codes easiest to pull.
Perfect. I wanted to make sure I got that correct, so when we send out our formal requests in writing, we have the right area.
Yeah, and I know you guys, I just saw the question pop in the chat. I know you guys asked originally for adolescent, but because we do see coding for neonatal exposure and secondhand smoke in our younger EPSDT population, do you want this to be for the entirety of our 0 to 20-year-olds?
Now, if that's and someone else just asked the question, do we want 12 to 17 or 12 to 18? I think if your data set lends itself to, newborn to 20, that would be helpful. If it's easier for you to do newborn to 17, I'm fine with that too. I think any data is better than no data. And I'm just, my mind was sitting here. I don't know why, because I'm not a huge QI person, but I thought, what a great QI project for someone to look at how we're documenting in the chart, both use and passive exposure. And if we are, I don't think most people are thinking, hey, I need to put this code in here so that their MCO can reach out and offer them services. That would be a really cool, I think, project to look at, like, how do we push this forward? How do we get this claims data moving forward so that it is more useful for the MCOs to be able to reach back out to these folks and say, hey, we got a claim. We realize your child is exposed to, nicotine or is exposed to passive smoke. Is there anything we can do to help you with that? I think that would be incredibly meaningful for all parties involved.
I think I can speak for Passport. We would genuinely welcome better data there because it might allow us to change some of our internal processes with regard to reaching out to adults, our adult membership in a different way. If we can build that mapping easily between child and caregiver. So I love that idea. I will warn you that if we pull for 0 to 17, please don't be surprised when I show you that maybe there's a 2-year-old with an actual nicotine use disorder diagnosis. Those do pop up. We know they're probably not smoking. The youngest cessation work I ever did with a kiddo was a 6-year-old diagnosed with cancer who happened to be smoking mama cigarettes. And it's Kentucky. So we've all experienced that. But we will see a few 0, 1, 2-year-olds, and it's not you all. We know it's probably a coding error from the coding department, right? But just don't be shocked when those pop up if we share that level of data.
Sure. No, that would be very helpful. And I have been a pediatrician for almost 40 years, and very little shocks me at this point. So
good.
Yeah. All right. Is that enough information for you guys to be able to do that data pull for us for next meeting?
Yep, 0 to 17-year-olds, that's fine. We're happy to do that. So 0 to 17-year-olds, the 3 diagnostic categories that we already discussed, and you're looking for the number of members specifically based on age that fall into each one of those diagnostic categories, correct?
Correct.
If we can break out vape, which again does not get coded, I think, as correctly as it could be, you would like us to do that. I know that we're all aware that's an issue. Okay.
Yes. And then and I know you guys will probably follow up with what kind of resources you have available for cessation. Okay.
Yes.
Okay.
Resources and any efforts that we have or things that we're doing. Correct.
Okay.
Okay.
Great. Okay. So that will move to our April meeting. And I appreciate the clarification so that we can ask for the best data. Anything else on this? Okay. Under general discussion, we wanted to talk about future topic suggestions. Since we are now going to do this discussion in April, I don't know that we also want to tackle this update on transportation resources. That may be something that we request data on for July.
Yeah.
But I will tell you the next item on the agenda is really something that maybe we push forward with the new changes. And I know Dr. Terrio probably had some information or thoughts on this. All of the stuff that's going on right now with the change, the recommended change from HHS about vaccine schedules and vaccine data, that now CMS is not going to require vaccine data to be part of quality measures, is what I understand. But Dr. Terrio may be able to clarify that a little bit more for me. But obviously, as a pediatrician, things I'm reading in the news are pretty worrisome to me. And I just kind of would love to hear. I feel like this is going to be a discussion that maybe this needs to be our July discussion to see where things are going to be going with this. But I don't know if anyone has any comments or updates on what we think is going to happen with the state legislature, if anything at all. Does that make sense?
Yeah.
I just have one comment that we are not planning on changing any of our quality measures at this time. And we have vaccines in there.
Okay. And I would assume that there's no plan change for I mean, when will we know about this new immunization schedule, or are we even worried about what HHS is going to say? Or are we staying with recommendations from other organizations at this point?
We work with our public health colleagues on this, and in the beginning of December, when they changed or they stopped recommending the hepatitis B at the newborn visit or at when a baby is born, HHS did. Our Department for Public Health put out a provider notice stating that we are going to continue to follow the AAP, which means everybody is offered the Hep B vaccine within 24 hours of birth, and then, follow from there. I have not talked to them about this since, but because they are following AAP for hepatitis B, I'm assuming we're going to continue following AAP.
And I assume everyone on the call knows kind of what's going on, but just to clarify, there's been a recent recommendation certainly that's coming out that says that HHS is going to recommend fewer vaccines. The AAP has not followed that recommendation at this point. And so I think, and the other thing that was certainly in the news story that I saw, and again, Dr. Terrio, I'm going to rely on you because I feel like you are having those on the ground communications, is that at this point, we don't know that this is going to keep insurance companies from paying for immunizations that families want for their children.
Actually, that's correct. And in fact, with the federal guidelines that just came out or guidance that just came out, they said specifically that immunizations will be covered by the insurance companies, that they're changing what is required recommended down to the have a conversation with your provider about it type of thing. But they're not changing immunizations coverage. So if you have a conversation and you want RSV vaccine, for example, then you can get it.
Okay.
Paid for by your insurance company.
Okay. And that's true for the VFC program as well.
I don't know.
Okay.
And it depends. It depends on how our regulation is written, because it goes back to what guidelines we have in there. We don't put in there what Kentucky says. We say we follow X guidelines. And so it honestly makes me a little worried because I don't know what the federal guidelines are for that. And so we have to look into that. It might just be me worrying for nothing, I hope. But it might get down to having to look more detailed about what recommendations we follow and what that means for VFC and what vaccines VFC will pay for, and that might be a big issue. So we'll see. I'm sorry, I don't have an answer.
Yeah, no, but I mean, I feel like there's a lot of concern about that. And I would assume everyone on the call knows this, but VFC is the Vaccine for Children's program that covers vaccines for children who are uninsured or who have Medicaid, just in case there's anyone on the call that isn't familiar with that terminology.
One thing, we could always invite the DPH, the Department of Public Health vaccine people, like Dr. Winters, to come and talk at the next meeting about this, if you were interested.
Okay. No, I think, I guess my question is, will there be time for that discussion in addition to the presentations that the MCOs will be giving? It is a 2-hour meeting, so we certainly, and maybe we will have more information in April that can be presented.
Donna, this
yes.
is Erin. I was just going to say, if you want to switch the months, if you feel like this is a more dire topic for this TAC, we could always request that the MCOs do their presentation in July instead of April. So that's always if you think that's a more urgent matter.
I feel like it may become a more urgent matter before now and then. I'm hoping I'm wrong, but I am quite concerned. What do other TAC members think?
It seems like it would make sense to maybe change the order of things if we could get Dr. Winters to come or whatever you think would be most informative in April, and then see about the MCOs doing their presentation in July about prevention and cessation. I think that sounds
I agree. I think
great.
it might be better to do that, the immunizations in April at our next meeting.
More timely.
Then we will, yeah, I'm sorry, go ahead.
Just more timely, yeah. And
Yeah. And again, this is just a kind of a question out there, and maybe nobody knows the answer. Do we know if there are, and we will know by April, I suspect, if there's any movement in the state legislature to address this issue?
By April, we should know what's
Okay.
going on with that, or at least have a better idea if anything's happening.
Sure. So let's do this. We will reach out to Dr. Winters and get an update on immunization schedules, coverage recommendations, and do that in April. And then the MCO presentations will come in July. Is everyone okay with that change?
Mm-hmm.
And then perhaps the update on transportation resources might be pushed to our fall meeting. Is everyone okay with those changes?
yeah, sounds good.
Okay. All right. MAC meeting representation. I think the last time we met, the MAC dates were a little bit up in the air. And I'm sure that's been solidified at this point. Aaron or
So
yeah,
Donna,
Barbara.
this is
Yeah.
Barbara from DMS, and yes, we do have our MAC meetings all set. We have one coming up on February 5th. There's one on April 2nd, June 4th, August 6th, October 1st, and December 3rd.
Okay, so those are all Thursdays, correct?
They're all Thursdays, yes, ma'am.
Okay. So again, I feel like that kind of puts us in the same unfortunate position that those of us that have clinics that day, it's hard for us to get to those meetings. So I don't know if there are any other members of the TAC that that could be available to attend those meetings as a representative of the Child Health TAC.
I still have my heart transplant clinic on Thursdays, so that's still not workable. Sorry.
Yeah. Yeah. And I'm still in clinic on Thursdays as well. So something just for us to think about, maybe if there is something pressing that we are, putting forward recommendations to the MAC that we feel like someone needs to be there, maybe we can kind of deal with that at that time. Our next meeting, as we previously said, is on April the 1st from 2 to 4. And then we will go ahead when we do the minutes and we do the agenda for next time, we can put all of the dates on there. Any other questions, discussions? I feel like we're giving each other the gift of time today.
Yeah.
I don't think anyone ever objects to that. Do anything else before I ask for a motion to adjourn? And if the members of the TAC will stay on with Barbara and Aaron so that we can work on the agenda for our next meeting. All right, do I have a move to adjourn
I move to adjourn.
in a second?
I second.
Okay. All in favor? Aye. Okay.
I
Thank you all. We appreciate you being here. We look forward to seeing you all in April. And then if the members of the TAC could stay on for a few minutes, we will work on next agenda items. Thank you all.
Barb, just make sure you hit stop recording.